Welcome to one and all. My name is Susan Anderson. I'm Managing Director for Canada for Orion Health. And Orion Health is a proud friend of Digital Health Week Forum and today's webcast sponsor. We deliver technology and service solutions around the world, including here at home in Canada, for interoperability, electronic health records, clinical portals, and population health management. We also provide solutions that are very specifically directed towards the patient and their family. And just a few of these examples, digital care coordination tools that are used here in the province of Ontario for complex care patients, and also in Quebec for easy-to-use remote patient monitoring solution. Thank you for those of you that have joined here in person, and for those joining from across the country via the webcast. Digital Health Week 2016 is celebrating the third year of sparking conversation about digital health with Canadians. This week is dedicated to celebrating digital health and the benefits it delivers. If you received the Monday edition of the Globe and Mail, there was an insert in there with a story about shaping the future of healthcare, and specifically digital health having a profound impact and effect on the lives of Canadians. It's through these kind of personal stories, the story of a mother and her son, Michelle and Elliot, her son, in terms of the impact of having direct access to their own health information online through a personal health record initiative in Nova Scotia. Very exciting. If you haven't had a chance to read this story, I recommend it. It reminded me of an earlier story when I was living in Alberta of David Price and a message that was delivered about 3 years ago that very much personalized what some of the issues and challenges were in the health system that had direct consequence of leading to very specific policy and initiative changes on the part of government and the health system. So take the time to read that story. Digital health events are happening throughout this week, and in addition to today's forum, we have the InfoWay Partnership Conference. It's happening tomorrow and Thursday here in Toronto. The InfoWay Partnership Conference is an annual event designed to create a forum for knowledge exchange, debate, and discussion. Following that, on Friday at 1 p.m. is the State of Digital Health in Canada tweet chat. That sounds quite exciting. Join patients, clinicians, and health organizations from across the country at #ThinkDigitalHealth at the close of Digital Health Week. A 1-hour Twitter conversation will take a closer examination of how digital health is at work today. Learn more about digital health and Digital Health Week by visiting www.betterhealthtogether.ca and join in on the discussion through Twitter to #ThinkDigitalHealth. You know, public speaking can be a most stressful endeavor. In advance of today's digital health program, I visited the Help for Me content site on myhealth.alberta. That's Alberta's public-facing personal health portal. Help for Me supports teens and adolescents with relevant information and lookup of local services for difficult issues dealing with mental health issues, with drug and alcohol type issues. I found 16 tips identified on Help for Me dealing with stress. My favorite on this list of the stress breakers is using laughter. When you laugh, you breathe in more oxygen, your body relaxes, chemicals circulate through your body, you sort of feel good, increases your blood flow, relaxes muscles. So I thought, okay, here we are together, very serious discussion on digital health. I want to share a brief story as a kind of my dealing with the stress. I went to see my doctor last week, and he tells me he has good news and he has bad news for me. I said, give me the good news first. He says, they're going to name the disease after me. Okay. All right, we've all got a little bit of stress relief going there. Okay. Anyway, I'll stop there. That's no more jokes. It's my pleasure at this time to welcome to the podium Michael Green, President and CEO of Canada Health Infoway, and thank you for my opportunity to share.
Great. Well, hello everybody, and welcome to everybody on the web. And it's great to be here. I don't have any stress-busting jokes, but I think laughter is definitely, I can subscribe to that philosophy about laughter anyway. And so Canada Health Infoway and myself, we're all proud to be part of Digital Health Week. And you know, although medicine is built on innovations in terms of technologies like MRIs and all sorts of things like that, sometimes in the areas of digital health, it's not quite so far advanced. And I think one of my personal goals is to see the death of the fax machine, for example, in healthcare. And you know, I think in the end, what we know is that to be successful with digital health, it needs to have all the players collaborating. And so we're not just talking about the healthcare professionals, but we're talking about all different health stakeholders, whether they be in the private sector as companies supplying health care institutions, whether it's hospitals, but more importantly also the people who the efforts are directed at, which is the patients, citizens, and also their families. And Digital Health Week has been an effort to kind of raise awareness in digital health issues and to also swap success stories and so on. And it's very important in this effort to have a good stakeholder kind of gathering to support the effort. And each year, it's been great to see that Digital Health Week has expanded very much in its efforts. And we have a number of great organizations that are supporting the efforts as well, and this shows some of those organizations across the country that are adding support, and we're very grateful to that. And then also our webcast sponsor is Orion Health, and we have many other sponsors as well, and friends of digital health, and I think those are now showed on this next slide here. And so very grateful to Orion and all the other companies that are lending their support and sponsorship to promote Digital Health Week. So at Canada Health Infoway, Canadians are the heart of everything we do in terms of pursuing our vision of healthier Canadians through innovative digital health solutions. And at the first time, Infoway has got the designation of patients included. And we'd like to talk a little bit about this and and certainly give our thanks to our Digital Health Week patient advisors who have volunteered and given their time and voice to help shape the week. And I have another slide, and I'd like to recognize the advisors: Gillian Code from Victoria in British Columbia, Brian Penner for Altona in Manitoba, Sarah Keeley from Ottawa in Ontario, and Annette McKinnon from Toronto in Ontario. So thank you for your support. And also like to recognise and congratulate 5 patient caregivers and family members from across Canada who have received the Engaged Patient Awards from Infoway's Imagination Engaged Patients Challenge. They represent 4 provinces, and each has a compelling patient caregiver story to share. And so here I'd like to acknowledge Nikki Christian Miro from Grimsby, Ontario, Sandra Dawson from North Vancouver, British Columbia, Dennis Coverzin from Winnipeg, Manitoba, Gary Laxdale from Calgary, Alberta, and Laura Palmer from Prince George, British Columbia. So applause again. Great, so these individuals were chosen out of 27 participants in the challenge, and they're joining us for today's forum at Infoway's Partnership Conference that starts tomorrow and on the following day on Thursday as well. And all these events are part of Digital Health Week. So to every one of these people, and also the many other Canadians joining us in the room and through the webcast, as patients, caregivers, and family members, I want to say that you'll play a key role by sharing your experiences and insights about digital health. Your voice will help other Canadians make the critical transition from patients to partners in their healthcare. Thank you for being part of Digital Health Week and today's event. In a minute, Sheila Maloney, Infoway's VP of Consumer Health, Communications and Evaluation Services, will provide an overview of the state of digital health in Canada. And as we celebrate Digital Health Week throughout Canada, it's never been a more exciting time for digital health. If we look at, I think, the next slide, the Health Minister, Philpott, the Health Minister, as many of you know, from Ontario. She is a practicing, or has been a practicing, primary care physician, and personally she's very aware of the benefits that digital health can provide to healthcare providers, but also some of the difficulties in implementing those as well. And we're great to have Dr. Philpott as the Health Minister. She has put her focus and the focus of the government on some specific areas. For example, recognising that in Canada the healthcare system is very much based on a hospital system. But there are great opportunities to provide better, in some cases, more effective and more cost-effective care nearer to home by focusing on home care and really focusing on how we can treat people in their own environments and make care more convenient, reduce the number of unnecessary hospital stays, and really focus hospital work on acute care where that should be focused. The government has looked at a $3 billion promise in terms of health accord to focus on these programs, and many of these will involve digital health and innovation. And other themes that kind of around that are within palliative care, mental health, which is a growing issue, particularly with youth, where there's a difficulty getting access to services, and there's a role that digital innovation can play here. Looking at First Nations, Indigenous people, we're aware there is a discrepancy in the levels of healthcare provision and access for many populations across the country. Digital health can be a kind of leveler and enabler in that way. On drugs and prescription drugs, you know, pharmaceuticals are the second highest cost of the health system across Canada, but also there's safety issues in the news lately. There's a lot of press about the growing problem of opiate abuse, some of which has arisen from inappropriate prescribing, and this is again something that can be kind of controlled or helped by digital solutions. And then we have other areas like improving access, looking at the overall cost of care that's rising all the time, and the role of innovation to really focus on these areas. So the Minister has been to our board meeting. We've been able to have a discussion with her, and we know that she is really engaged in a number of these programs going forward and is looking for the success of programs and also events like Digital Health Week. So with that, I would like to hand over to Sheila Maloney, who's going to focus on some of the results of the studies we've done. Thank you.
Thank you, Michael. So I'm feeling tremendous pressure, nothing like stress. You've got an empty whiteboard with my name on it. I'm not talking. I'm not going to stop talking until that board is full. So let's hope that I've got some deep inspirational things to say that we can fill this board. So I would like to add my welcome to Michael's. Really appreciate you all coming today. A special warm welcome to all our patient advisors and our patient digital health award winners and our challenge winners. And thank you for taking the time, whether you're participating on the webcast or whether you're participating in person. We really appreciate you coming out to our first annual, our first ever Digital Health Week Forum. And we're especially proud of this and proud of the Patients Included designation, so thank you. What I thought I would do in my presentation today is provide a little bit of context, and then because Digital Health Week is about conversations with Canadians, I'll give you a little bit of information about the surveys that we do with Canadians and how they feel their attitudes and perceptions around digital health, and then spend the last little bit of time talking about global trends and where we think technology is going and what the next steps are. So before I get into that, however, there are cue cards on your tables if you are interested in asking questions, and at the Q&A session, you can just lift those cards up and somebody will come around to collect them. There are mics in the room, certainly use those. If you're on Twitter, Think Digital Health, hashtag Think Digital Health. We want a trend, so feel free to tweet liberally and often. And if you're on the webcast, there is a Q&A function, and you'll see it's listed right there, and that's how you can use it, and please take advantage of that as well. And we will have time for Q&A at the end of the session, unless I don't say anything meaningful and I got to talk too long to fill up the board. So a little bit of Canadian context. In 2001, Canada Health Infoway was formed, and the healthcare system looked a lot like this. And I remember one of the first papers that was published after I joined Infoway was called "Your Healthcare Doesn't Look Good on Paper." And I thought it was a very appropriate and sort of cheeky title, and very appropriate to where we were at that time. And then, as in now, there are a number of pressures on the healthcare system. One of them as a result of our aging population, and as a result of the population aging, we have an increased burden of chronic disease. And so, just to put into context, 67% of all direct healthcare costs are used for chronic disease. 67%, $190 billion is the economic impact annually of loss of productivity and other things that result of that significant burden of chronic disease in Canada. And so that existed then, it exists now. I don't think that's changed. One of the things that has changed today is that technology is everywhere. Technology has affected the way we work, the way we play, the way we communicate. We are now a very consumer-driven society. We are always on, and that's largely as a result of technology. And I don't think anybody in this room would certainly have a quarrel with that comment and that statement. Another thing that hasn't changed, but perhaps has become a little bit more acute and more pronounced, is that healthcare costs are high. In 2015, CIHI reported that $219 billion is our annual spend of health expenditures in Canada today. And at almost 11% of the GDP, Canada is by far or healthcare rather, is by far one of Canada's largest employers. We had a board meeting a few months ago, and the Minister of Health came and spoke to not the federal, but one of the provincial ministers of health came to speak to our board. And I remember very specifically, he talked about neither he nor any of his colleagues around the ministerial table, health ministers, wanted to be the minister with the dubious honor of being the first minister whose provincial budget for healthcare surpasses that magic 50% mark. And there are a number of provinces that are close. So clearly, that's an issue that we're facing. So given that technology is ubiquitous and given that health spending is high, my premise and our premise at Infoway is that digital technology is driving innovation, and the health sector can absolutely benefit from the transformation that will be enabled by digital health. We are committed to that premise, and I think we have a number of we've made a lot of progress through our federal investments and through our provincial territorial investments in healthcare. And just a couple, I'm not going to go through this slide in its entirety, just a couple of things to point out. This infographic is in our 2016-17 annual report. When we started this endeavor, we got $350 million for electronic medical records in physician offices. In 2007, when we started, about 25 or 30% of all primary care physicians had emergency medical records in their hospitals, or in their primary care clinics, rather. That number is now, the average across Canada is 73%, and in provinces like Ontario and BC and other places, that number is more like 80 or 90%. So we've made significant progress in that area. Also, with the investments in diagnostic imaging, drug information systems, telehealth, lab information services, we've accumulated about $16 billion in benefits of cost savings and cost avoidance. So we are making progress in this area. So what does a digital landscape experience, what does it look like from the patient's perspective? Well, we go out and we do annual tracking surveys every year. We ask Canadians what they think about digital health. We also survey clinicians, nurses, pharmacists, and doctors, usually every other year. We also sometimes do special surveys. So, for example, in the next year or two, we will be doing a survey specifically around privacy and security. We haven't done one of those for a couple of years. So we ask Canadians what they think about healthcare. And so I hope it wouldn't surprise people in this room that 96% of Canadians perceive the importance of taking full advantage of digital health tools. I really don't like the way that's worded. We need to change that. But it says, so 96% of Canadians feel we need to take full advantage of digital health tools. 74% of Canadians know that digital health there's a perceived impact on the health system. When we ask them about digital health and the level of agreement about how digital health helps care providers, you'll see 86% understand that digital health and having the information available electronically facilitates access to information for their care providers. 85% recognize that, again, digital health and having access to electronic health information, it facilitates the coordination of care between and among providers. And so Canadians, when we ask them, they really understand what the benefits are of digital health and are strong believers in that. Again, 96% of Canadians feel it's very important that health records be kept electronically. And when we ask them, again, why, certainly some of the common themes we hear is, I don't have to repeat my history time and time again. We know it eliminates the need to do repeat lab tests and those kinds of things as well. Then we ask them about tracking their information. So 96% of Canadians think that it's very important that their information be kept electronically. And then we ask them, for you and for your caregivers or your family and those for whom you care, what percentage or how do you keep track of your information? And so you'll see 68 and 69% of Canadians rely on their doctor or the regular place of care to keep track of their electronic health information. The next biggest category is I have a physical record that I keep on my own. 10 to 15% say that. So people are still relying on their family doctors and their regular place of care. Is that consistent with the room? How many people have they have electronic health records with their physician or not with themselves? Okay, so 68%. We're exactly like the population of Canada. Then we ask them, how confident are you that your care providers are sharing the information and a holistic view of your health? And unfortunately, the larger bar is the 70% of Canadians say they're not confident that their physicians are sharing information and they have access for sharing. And so I think, is that consistent with sort of the understanding in this room as well? For those of you on the webcast, there's lots of nodding heads, and if you're on the webcast, I'm sure you're nodding at home as well. This is one of my favorite slides because I think it really talks to the benefits of having online access. And so we asked Canadians what they want, what their expectations about the healthcare system are. And one of them is that they want access to their health information. And so for those who do have access to their health information, you see the statistics are very high. At 69 to 71 to 75 to 74% of them say they are more knowledgeable about their health care. They feel more confident in being able to take care of themselves. They feel that they are more confident in the care that they are receiving, and they feel that they can have better communications and discussions with their primary care docs. So they are more engaged and more empowered. And we know that engaged, empowered patients have better health outcomes. And so that's really critical, and that's a great benefit in and of itself for giving Canadians access to their health information. So of course we also ask them about their perceptions of privacy and security. And because when we ask them, they clearly understand what the benefits, but one of their biggest concerns across the board, universally and always, is privacy and security. And that number has gone down. The concern levels have gone down over the years, but it's still the number one concern. So when we ask them about the percentage of Canadians that say any concerns they have around privacy and security of their electronic health information are outweighed by the benefits of having access to it. So you'll see that, and I can't read that number, 56% of Canadians feel that them having electronic access to their information outweighs the risks of privacy and security. The little smaller circles are a little bit more telling as well. So what we did is took that number and then we segregated people who have access to electronic health records and health services to those who do not. And in fact, those who have access to digital health and digital health solutions and tools are actually more confident that the benefits outweigh the risks. So the number jumps to 63% for those who have access versus 54% for those who don't. So nice telling statistic there that, again, is very wonderful to us. Then finally, we also ask, and every year we ask the same questions as much as we can so that we have some comparability over time so we can track this information. But every year or two, we want to add more information and new questions so that we can start sort of looking at trends, et cetera. And so one of the questions we asked in last year's survey is we asked people how many wear digital trackers to track their health or their fitness or use apps in any kind of way or wearables. And so 21%, so before I take the answer, how many people here have a Fitbit on or use a tracker to track wearables? What percentage of that is the room? Is it 21%? Yes, 21% of Canadians wear wearables to track their fitness levels. And what's interesting is we asked them, so do you share that information with your healthcare provider? 16% of those who track their fitness levels do share that information with their healthcare provider. And then we asked them, would you be willing to share if they asked? And that number jumps to 85%. So something to keep track of and some interesting information for us anyway. So that's all I'm going to say about the annual tracking survey. There is a report that's published. It's called Connecting Patients for Better Care. It's a report that's available on our website. Certainly, if you want to download it, there's some interesting infographics that you can use and share. And so now what I thought I would do with the remaining time, again, is talk a little bit about where we see things are going and global trends. And so we sort of amassed information around Accenture and KPMG and PwC, and a number of the consulting groups do talk about global trends and where they're going. And so what's next for digital health technology? Well, the first thing is that governments and payers will require new approaches. I think we just had a meeting this morning with all the provincial territorial CIOs are meeting here today. And one of the things we're talking about is the changing role of ministries of health and departments of health and governments. And we're seeing increasingly that the line is blurring between sort of health and social. And so that you can't take care of health issues and you can't really treat a lot of health without thinking about the social systems as well. I was at a session where there was a doc from Hamilton, and he was talking about one of his patients, a gentleman in his late 50s who was diabetic. And no matter what he did, he couldn't just control this man's A1C levels. And so, did I say that right? Thank you. And so, they just couldn't get it under control, and he tried everything. But finally, the patient said to him, you know what? He said, I lost my job 3 months ago. My wife's just been diagnosed with cancer, and I just found out my teenage daughter is pregnant. He said, I don't care about my A1C levels. I've got other things to worry about. And so, because the physician worked in an interdisciplinary team, and there was a social worker on the team, he connected him with that social worker and set him up and gave him some great services and insights. And he said, I didn't cure his diabetes, and we didn't manage it or control it, but that was the best probably patient service that I've provided in ever. So it makes a difference, and so we're seeing the blurring of those lines, and governments are starting to recognize that. We also recognize that there's changes in approach are required. Procurement is another big one. Procurement right now, and we've got some vendors who have these great ideas, but they get frustrated and they leave the healthcare space because they say it's an 18-month minimum procurement process by the time I sort of have my idea and shop it around, and they can't wait that long, and they don't have the money to be able to carry them for that long. And I was at a meeting with a home care association, and they were talking about their procurement issues, and I think she summed it up quite well, and I'll tell this little story, is that she said, we get a procurement that we respond to, and it says, you must provide visits face-to-face. You must provide them Tuesday between 4 and 7. They must be provided by a nurse. The nurse must be left-handed and have brown eyes. And so by the time you get to the scope, and please be innovative and creative in your response to the RFP. So that we can't continue to operate that way. And so I think jurisdictions are very much recognizing that and looking at different ways to be more proactive in their procurement processes. Physician remuneration is the same kind of deal. Is that if virtual visits, we've got great evidence that they are effective and they are working. Kaiser Permanente now, almost 50% of all their visits are done virtually. We need to change the remuneration of physicians and clinicians so that we can move and take advantage of those digital health technologies. So a lot of policy enablers, and I think governments have to think a little bit differently. So we're certainly seeing that, and that's a global trend that we're seeing. And I think, the other thing they talk about is disruption and being more disruptive and thinking more disruptively when we talk about digital health and organizations, what they'll need to do. And there's a few things they talk about is don't serve your clients, collaborate with them. And they talk about not competing with your rivals, but partner with them. And don't conform to the rules, break them. And so just thinking outside the box a little bit and being disruptive, and we're certainly seeing that in other sectors, and I think we'll start to see that increasingly in the digital health space. But we are digital. We need to be aware of what the digital risks are. Clearly, there's security and privacy is a whole different ballgame when we're talking about online and electronic information, et cetera. But there's also technology that will support those. So just being aware of what the added security risks are. And they say the most effective organizations, it's not those who won't have breaches. Everybody will have a breach. It's a when, not an if. But you'll be successful as an organization if you have some analytics and some monitoring so that you can identify those risks on or right as they happen, can isolate them quickly and move and resolve them and move forward. And so that's what we're going to see increasingly. We need to respond to consumer privacy. We need to use the digital technology ethically, especially in the healthcare space. And so all of those things are changes that we need to be aware of in digital health. And one of the things they also talk about as this global trend is this whole idea and the notion of digital trust. So, and especially in healthcare, that's going to be important. We know that when we did some patient focus groups, we heard increasingly that when patients, they don't really know who Canada Health Infoway is. Unfortunately, we're not a household name yet. But they did sort of associate us with sort of a government thing, and they were much more what's the word I'm looking for? Less worried about providing information or having a government entity involved in their healthcare versus a private sector or something like that. So it makes a difference. We need to do that. And then finally, we're seeing a global trend, of course, and that's why we're here, that's why we're all here, is this whole patient-centered care. And in fact, it was a consultant from KPMG was doing this presentation, was talking about that. She says, I traveled to the UK and Australia and places like that. Said, oh, you're still using that term patient-centered care? That was so 20 years ago. Now we're saying people-powered health is what they're calling it. And so I think that's a nice way to put it. But we have movements like Patients Like Me and slogans like Nothing About Us Without Us. And so we're seeing some really great things that are happening, especially in the UK around patient empowerment. And one of the other things they talk about is get patients involved. They have the lived experience. They know what's going to work. And they also talk about millennials and the importance of including them as well. She says, because we think we get it, but we don't. They think differently. So really not only bringing people and engaging patients in this, but also patients of all different ages and sectors as well. So that's really important. And the other thing, there's various studies that most of them come out of the UK, but some come out of Australia, and we're seeing that in Canada as well, is that engaged, empowered patients have better outcomes for all the reasons that we probably talked about earlier in our survey around they're more confident in their care, et cetera. And they have better health experiences and better health outcomes. And that's great for the patient, and that's great for the healthcare system, because what it does is when you focus on patient experience and you focus on quality, you will save money. There's reduced absenteeism from work for those who are working in the health system. There's better patient choice. Patients don't use as many services because they're not coming back as often. So it makes a difference. So we really need to embrace that people-powered health. And then finally, my last slide is the whole idea, and coming back to that first premise around transformation. So we know that technology is changing our lives everywhere in every domain. We know that we've got some pressures on our system, and we believe very strongly that technology is a key enabler to help us transform that healthcare system. And so that's what we're looking forward to and having further discussions about over the next few days, and that's what Digital Health Week is all about. So with that, my board is almost full, so I'll stop there, and perhaps we've got, Christina, time for questions? Great. So again, if there's mics set up around the room, if you have a cue card, just raise it up and somebody will come and collect it, and then somebody will flag to me if we've got questions from the webcast.
I have one for you from the webcast.
Thank you.
Can you speak to a little bit about the vision for connected records, so the ability to share between health authorities, for example, or providers?
Great. So, you know, clearly that's one patient, one record is sort of the motto and the holy grail of what we're trying to get to, and it's important. And I think that whole connected care premise is around, you know, connecting physicians with the information about the patient, connecting clinicians with one another so that the specialist and the clinician have the same information, and connecting clinicians with and patients with their clinicians and with their health information. And so there's lots of things, and you know, we're certainly continuing to move on the investments that we've made around diagnostic imaging and drug information systems and lab information systems. We've had great efforts. We've put a lot of attention on the EMR space and the primary care physician, and so that will continue. And now it's really empowering Canadians with their health information as well. And that's sort of that's the sort of the genesis and the flow that we see around that. Yeah, go ahead. If you, yeah, that would be helpful for the webcast. Thanks.
Yes, I have a question about electronic health records. And that's traditionally patient records have been kept for the benefit of other doctors or for the doctor keeping the record. And there's a shift in thinking between the doctors starting to write notes for the patient's benefits. How can you help clinicians make the shift?
Well, it's a great question. So I'll talk specifically about what Infoway is doing, but I think clinicians are making that shift on their own. So I think there's two things. One is, you know, from an Infoway answer, we do have clinician reference groups, and we do have peer-to-peer networks. And so we're working with the schools of faculties of medicine, nursing, and pharmacy to try to, you know, ingrain that culture. It's not the new folks and the new docs and clinicians that are coming forward, but really trying to help physicians understand the importance of doing that. And I think most of them are there, clearly, but we've got some resources that are available to do that. But I also think, you know, patients and Canadians are very much a part of that, and you can access your health information. And so it was interesting because I was making a presentation at our CIO forum earlier this morning, and one of the things we were showing them the information that said Canadians want to access their health information. And one of the comments was, but they won't understand it. And then, of course, the provinces that have patient portals, provincial-wide patient portals, were quick to disagree, and they say, you know, and if I have a chronic disease, I might not understand that lab result the first or the second time I see it, but I will understand it because it's in my best interest to understand it. And usually they're quite easy to read and see. And so if anyone has, you know, I don't know, you have to be the only one. If you have a comment or question or an experience, please share. But I think that's the piece of it is, and you know, some of the things are as easy as if you have an EMR in your office, flip the screen so the patients can see it and review them together. And they say quite often what the clinicians are doing is they're telling their patients about, you're going to see these lab results online. You will see them maybe before I do or before we have a chance to talk about them. Here's what you should expect. Here's what you're going to see. Here's what's normal for you. And so it's an education opportunity. And I think clinicians are certainly seeing that and embracing that. But if anyone has any experience with that, I'm interested to hear.
I'll give you another one, Sheila.
Okay.
What do you see from your perspective as being the single largest barrier to the full adoption of digital health solutions other than money?
And I would like to have world peace too. The single largest barrier, wow, that's a tough one. Can I give you two or three? So I think there's, I would suggest that we make the system complex. There's remuneration, there's privacy and security. We have the fact that we have 13 systems is an issue, and we need to harmonize some of our privacy and security legislation as one example. I think so. Sort of the barriers around policies are one of the barriers I would suggest. I think it's a culture, and it's a very provider-centric culture we have right now. And so we're changing that, and that is changing. I think Canadians are lending their voice and are not putting up with things. I mean, you know, my niece calls me a woman of a certain age, and we don't put up with and tolerate things, although some of us are very willing and happy to sit for 3 hours in our doctor's office. Why is that? And so I think that culture is shifting and changing as well. So I think those are two of the big ones, Christina, that I would suggest. And world peace.
I have a theme happening through the
Okay.
webcast. People are very interested in digital health and trying to find it for themselves. One specific question is, can you share some examples across Canada where Canadians are using personal health records? Where do those exist? How do people find them?
Great, but I would open if anyone has experience in this room. I know, Sarah, you've got a story, but how people are using their personal health information. I think we've got apps as an easy example. So there's some, you know, the Global Center for eHealth Innovation, they have BANT is their app to help people manage their diabetes and those kinds of things. People are sharing their wearable information with their physicians. Definitely Lori, I'm looking at you, telemedicine, telehome care is a big one. We've got, we received $10 million from the last budget for telehome care services at InfoA, and especially in the patients with congestive heart failure and pulmonary disease, we are providing them with medical devices as they're being discharged from hospitals, and they are electronically transmitting that information to usually a nurse, but a coach, and then there's daily or weekly as need dictates interaction, and there's a coaching function. And that's been incredibly successful, 40 to 50% reductions in repeat hospitalizations and visits to the emergency. And caregiver burden has been greatly lessened, and patient satisfaction rates are through the roof because they feel secure and they've got somebody, you know, sort of is watching them. On mental health, youth mental health especially, Michael mentioned that earlier, there's lots of opportunities, especially youth feel a little bit apprehensive to meet somebody face-to-face and going to a clinic. But there's something that in the Big White Wall that we're piloting here in the UK, and it's basically a website where youth, under complete anonymity, can go in and just type how they're feeling, and then somebody's monitoring that. And so if they feel that somebody might be in distress, they'll break the glass, and they will say, how are you feeling today? And that has been, again, we're just piloting that now, but so far, really great successes. So there's just a couple of examples, and I know there's lots of other people who have examples of that in the room, so we're looking forward to the dialogue with that as well. Brian.
Got a question for you. Why are clinicians reluctant to communicate with their patients via email? We have a lot of patients that are not close to their clinicians globally, but yet they may have a quick question and say, I'm having a rash or something, what can I do? If you can't phone them, clinicians aren't willing to communicate by email. And why is that? Is that the Privacy Act, or what are they hiding behind?
Yeah, so I'll give you a couple of perspectives, and we've heard from some clinicians, and if there's clinicians in the room that would be interested, I'm certainly happy to hear your thoughts as well. I think to some extent, you know, email is not secure, so they don't want to, you know, give a full history, and they have to be very careful. We know some clinicians are communicating via email to some of their clients who they know, or their patients rather, who they know they trust and they have a relationship with, but they will be very clear about not mentioning things that might violate privacy or that might be upsetting or disturbing or embarrassing if it was found out in public. So that's one thing. But they don't get paid. And so the remuneration is another issue. So I was complaining to our clinical reference groups and was sort of saying, in terms of renewal prescriptions, that we know that if Canadians could renew their prescriptions online and could review their lab results online, we would save 47 million face-to-face visits a year in Canada to primary care physicians. That's a lot. So when I told our physician reference group this, they said, yeah, but I need to see that patient to renew the prescription. And that's true for some prescriptions that you need to physically touch and you need to look them in the eye, and depending on what the prescription is, and maybe every 6 months, I would argue my doctor needs to see me. But for what medication I'm taking that hasn't changed in 7 years, I don't need to see her every 2 months. But she doesn't get paid unless she sees me. And so I think what we need to do is make sure, and that gets to one of the why is it so complicated projects, is we have to change the remuneration fee so that there are fee codes that will allow for physicians to provide care virtually and have it being valued by the system. So I think that's a couple of answers to the question.
There's a medico-legal aspect to it too, right? Because if there's an urgency and you contact your doctor and the doctor can't act quickly enough, then they might be liable. So the system doesn't really help them answer on time, or they might be liable for that. So.
Yeah. So for those on the webcast, for the response was, and very good comment, Ahmed, is that there might be a medical legal issue. So if you phone the doctor and it's an emergency, they might be liable. If they can't respond to you more quickly, there might be some liability issues that the doctor would want to avoid.
I have one last question for
Okay.
you, and then we'll move on to the panel, and there's lots of time.
That board's
for
pretty full.
Yeah, and we'll have time for questions after the panel. But one last one for you, Sheila. What are some of the behaviors that consumers can exemplify to drive the digital health agenda? What can we do?
Great question. So I think a couple of things. I think participate in forums like this, #ThinkDigitalHealth, talk to your clinicians. I think we'll all have that responsibility. I know my friends are certainly sick of hearing, what we're doing, and that's the way we do it. I think that's a big thing to do, and talk to the clinicians, let them know what your wishes are, seek out the digital technology, and that's I think the best thing to do. That's the best advice I would have for sure.